Today we are demonstrating Mulligan Technique starting with the neck. So our patient is going to be in seated position, and you want to make sure that the upper spine is exposed so we can be right on the skin. And it's important to remember that this is a treatment technique and not an evaluative technique. So previous to this, I would have had Mamadou in prone, and we would have evaluated his cervical levels to see what needed specific treatment. So I've assessed his spinal levels and I know where I'm going to treat. So what I'm going to do is I'm going to position him in a seated position, and I'm going to come in, and his head is going to rest right on my shoulder here, okay? And I'm not kind of pressing him in, I'm just letting it comfortably rest, okay? So it's very important that you let his head relax right on you. And then what I'm going to use is I'm going to use the middle phalanx of my fifth digit, my pinky. That middle phalanx is going to hook right under his spinous process, and then I'm going to let my hand rest right on his head to, again, provide him with some support so he can just rest. So this is my stability hand. This hand is not going to move at all through the duration of the treatment, okay? This is going to be my movement hand. So this hand is going to be flat on his back just like this. And I'm going to do it over the shirt so you can see what I'm doing. But if I was treating him, I would have skin on skin just to make sure I was moving his actual spine and not just a shirt. So I'm going to take my movement hand and I'm going to put my thenar eminence right in contact with that middle phalanx. I'm going to have about 2/3 of that thenar eminence in contact with that middle phalanx of the fifth digit. What I'm going to do is I'm going to move and take up the range till I feel about his end range. I'm going to back off 50%, and then I'm going to do my oscillation from midway through the range to end of the range. Okay, nice and easy. And it's very important that my force is going right through his eyes. And what I mean by that is my force is coming up this way. The cervical spine, the facet joints are at a 45-degree angle, so it's important that your force is right along that angle because we're trying to mobilize those facet joints of each respected level. So when I do this treatment, I'm going to do 10 repetitions and I'm going to repeat that for 3 sets. Now we are reviewing the Mulligan technique called the reverse nag. So what we're going to do is we're going to position our patient in sitting again. This time we want to make sure that we have access to his whole spine and that his shirt is off, because this technique is used for this mid-thoracic region, and we have to make sure that we get a good purchase on that level and we have a good preset alignment, so it's easier to have the patient with a backless chair. So what we're going to do is let the patient's head rest right on our shoulder again, and then we're going to position ourselves right here. Again, this is a treatment technique, so we've already evaluated and seen where we need to treat. And our hand positioning for this is going to be right on that middle phalanx of your second finger, and then the distal phalange of your thumb. So those are going to be our 2 treatment points. So what we're going to do is I want to make sure that I come down nice and low and that my elbow is below the spinal level that I'm on, okay? Because what I have to do is I have to drive up at a 60-degree angle. That 60-degree angle is the angle of the facet at the thoracic level, so it's very important that we're treating in that joint plane, okay? So again, I'm going to find that point, and what I want to do is I want to take up that slack, and then I'm going to go find his end range, back off, and I'm going to go mid to end range, okay? Nice gentle oscillations. Again, I'm looking for a set of 10. Get a nice ab workout during this. And rest. So again, just like with any Mulligan technique, you want to do 3 sets of 10 for this. Next, we are reviewing the snag technique, which is another Mulligan technique. So how the snag is different from the nag is during the snag, the patient is going to move with your pressure. So there's going to be active movement on the patient's part with a little bit of overpressure. So before I start my treatment, I will instruct my patient on what flexion extension is. Mamadou knows what that is, so we can bypass that for right now. And again, I've already assessed what limitations he has, so we're just going to move right into treatment with the Mulligan technique known as a snag. So what I'm going to do is I'm going to have the medial border of my distal thumb pad is going to be my contact hand, okay? And that's going to come right up under his spinous process. If he can't tolerate that, I can move to an articular pillar, but for right now, he can tolerate it, so I'm going to stay at his spinous process. So my movement hand is going to be my other thumb pad, okay? So what I'm going to do is I'm going to come up, and again, I'm going to mobilize that joint in the movement plane. So that's at that nice 45-degree angle, okay? So I'm going to have my fingers up, and I'm mobilizing him up, and what I'm going to ask him to do, Mamadou, can you please flex forward? And my hands are going to move as his spine moves. and come back up. Good. Next time, provide a little bit of overpressure, so we're going to move. And with that hand, provide a little pressure downward, and come on up. And one more time. And come on up. Good job. So it's very important with this technique that my hands move as he moves, because as his neck flexes, the angle of that joint flexes. So if my hands don't reposition as he moves, I'm going to compress that joint, and I'm not going to get the true result that I want from that snag movement. And again, similar with any Mulligan technique, you're going to go 3 sets of 10 for a treatment session. Now we are still reviewing the snag mobilization that is common with the Mulligan technique. Now we are going to put it in terms of rotation. So the previous video was on flexion and extension. This video is going to be on rotation. So for the sake of this demonstration, Mamadou has limitations with rotation to the right, and he has pain on the right, okay? So if he's limited in rotation to the right, and he has pain on the right, my contact thumb is going to be on the right, and my mobilization thumb is going to be on the left. So that's my movement thumb. This is different from if he had limitations to the right and his pain was on the contralateral side, so you have pain on the left side, my hand position would be over here. So it matters where the pain is, which side you're going to be on for the actual mobilization, okay? But he would still be turning into his movement restriction, which is very important, okay? So for this technique, we're going to say that Mamadou has limitations with rotation to the right, as well as he has pain on that right side, okay? So again, I'm going to make sure that he's sitting up nice and tall, because according to Frei's laws, we want to make sure that his spine is in a nice alignment. And what I'm going to do again is I already assessed to know where his pain is, where his limitations are. This is purely a treatment technique, okay? So I'm going to find that articular pillar at the level that I want, and I'm going to use that distal pad of my thumb on the right side is my contact hand, okay? And then with my left hand coming across in this motion, again, I want to come up in that 45-degree plane. I'm going to mobilize him up through his ear or through his eye, because that's the movement plane that we're in, okay? So what I'm going to ask him to do is I'm going to ask him to rotate to the right, and I'm going to rotate with him and come back. And on this one, he's going to give a little bit of overpressure with his hand into that rotation. So we're going to move and overpressure, perfect, come on back and rotate and overpressure, perfect. And again, very important with this to make sure you're doing 3 sets of 10 to make sure that you get the proper treatment result. The last Mulligan technique that we're going to review is again the snag technique, but it's for the lumbar spine, okay? So this primarily we only focus on flexion and extension, so that's what we're going to demonstrate in this video. Ideally, we would like our patient on a high-low treatment table just to make sure you're at an appropriate height so you're not going to injure yourself, because biomechanics is extremely important. For this demonstration, I'm just going to have to get a little low, but that's okay. So again, we've already assessed his lumbar spine and where he's limited, so this is purely a treatment technique. So your contact point is going to be your pisiform, okay, that carpal bone. And you want to make sure that that carpal bone, you have a nice purchase on his spinous process, and that's how you're going to mobilize, okay? So I'm coming down, and notice how my forearm is parallel with his spine, okay? That treatment plane is 90 degree, okay? So we really want to make sure that we're mobilizing that facet. Very important. So I'm going to come down, make sure that I have a good purchase point, and I'm going to stabilize him. I'm going to mobilize him up with my pisiform, and I'm going to ask him to flex forward as far as he feels comfortable, and come on back. Good. I'm going to move with him, so he's flexing forward, and coming on back. And one more time, flexing forward, and coming on back, okay? And again, very important with these snags to make sure that you're moving with the patient, because your pressure has to maintain in that treatment plane, okay? As that facet moves, you have to move with it and provide a proper mobilization. And as with these Mulligan treatment techniques, 3 sets of 10 is how you get the desired results.